Hey, it's Dr. Toker. This is Consent Corner, outdoors, under a tree on a sunny day. Perfect opportunity to describe what IPL is, why we would use it, what is our intended purpose, and what could possibly go wrong. IPL stands for Intense Pulsed Light, and it's used for many of the same purposes that they use lasers for. So in other words, light at a certain wavelength will find a target that has a color, heat up that object, and destroy it. So that's why laser hair removal works. That's why photofacials can lift spots out of your face. It's also how we kill little vascular lesions in your skin. This is done with light-created heat that destroys objects of color underneath your skin. And I hope I explained that in a simple fashion. But basically, a laser is one wavelength and only one wavelength, whereas an intense pulse light winds up being a spectrum of wavelengths in a very narrow range. So it has a little bit more broad-based use. It's also not considered a laser, and therefore it's a little safer than a laser, and there's fewer restrictions on who can use the laser and in what settings. And so we use that laser because of the safety, or correction, we use the IPL because of the safety profile. Why would we use this thing? Well, we use it to destroy hair. Notice how my hair is a different color than my skin. So with the right wavelength IPL device, we can kill hair follicles. I also am the perfect candidate because I used to play tennis and I've got terrible sun damage. But you see all these little sunspots, especially over here. We can get rid of that with an IPL, or at least we can vastly improve that. There's also a condition in women called Mylasma. I had that terribly when I was pregnant, but it's a hormone-based condition that causes sort of a blanket freckling in odd places. We can improve that. That condition is not exactly curable, but you can definitely improve it. There's also small spider veins right under the skin that people get, little gin blossoms. And I don't drink gin, but anyway, so that's what we call them. We get those little spots on your face, and we can lighten those as well, usually quite successfully. Now, with most of these treatments, regardless of what the pigmented object is, requires more than one treatment most frequently. Okay, so this is not some magic bullet you go in once and it's done. It takes some effort. When this light heats up and damages the target item, your body has to clear that. That's a biologic process that takes time. And so after you have this procedure done, you might notice some either redness to the area or an increased darkness in the little freckle object that you wanted lightened in the first place. And if it gets darker, that's actually a desired response. It means we've broken it up in a bunch of tiny little bits, and your body is trying to lift it out of your skin and get it off of your skin. So that's an expected temporary outcome. So what could possibly go wrong? Well, we could have a long-lasting, not expected outcome. In other words, a dark spot or a super light spot that forms as a result that is permanent. What are the chances of that? Well, it's pretty uncommon, but patients who have darker skin are more prone to those types of complications, so it's really super important. If you have darker skin, and I am not one of those people, so I've got really light skin, I burn. I could say the word sun and come up with a sunburn. I will have a sunburn from sitting in this shade more than 10 minutes. So I don't really fall into this category of darker skin, but some of you may have lovely Mediterranean skin or Asian skin or African skin or American Indian skin that's lovely because of its color, but also a little treacherous because of its color. Those skin types have a tendency to trap heat, and when you trap heat, you can damage the skin. So if patients in that skin condition come into the office, we usually will not whip them straight back and start treating them. We'll do a test area. So as eager as you may be to get started on your photofacial or whatever the case may be, we may treat an area and have you come back in days or even a week, depending on your skin tone. Someone with light skin like me, a damaging effect will become apparent extremely quickly within a few minutes. So my test spots will be probably behind my ear or on my forearm somewhere, and we just sit and wait for a few minutes to see if it turns red. Which it will, because I get burned real easy. Anyway, I have done this IPL procedure on the hair on my legs, and frankly, my legs did not turn bright red. And it works fantastic. So I can give wholesale approval to this technology. It does take multiple treatments to achieve the goal. The goal is never complete removal of the object. You can never remove all of the hair. You can never remove all of the freckles. Our goal is to diminish the effect of the aging process. And so what we want to do is even the tone of your skin. We want to get rid of things that show age, and we want to get rid of things such as hair, which are a convenience on an inconvenience on your legs and your armpits and those kinds of things. So that's the why we would do it and what we would expect and kind of what would go wrong. Super duper important. However, if you hear nothing else, hear this. Don't have an IPL treatment and forget to wear your sunscreen. The IPL is sort of like the sunlight, and if you have that treatment done and walk out into the sunlight, you are going to damage the skin. And so we tend to do more of these procedures in the wintertime, and we also highly suggest sunscreen, and we have a big bucket of sunscreen at the office if you need some. And what else can I tell you? I don't know. Okay, here's to having fewer age spots, smoother skin on your legs so you never have to shave again, and we'll see you at the spa.